The West Virginia Office of Drug Control Policy released their 2025 snapshot and statewide overview. 13 News reporter Delaney Wells sat down with the director and shares what they found last year and are looking toward in the new year.
Department of Human Services released their county snapshots and West Virginia at a glance overview. According to Dr. Stephen Lloyd, director of the Office of Drug Control Policy, overdose deaths are down nearly 42% in West Virginia. He says Mercer and McDowell counties are two in the state with the highest overdose rates due to a lack of resources.
If you look at Mercer and McDowell counties, I mean, those are, even before I came to West Virginia a year and a half ago, I knew those places, right? I knew them by reputation. I mean, there was two of the hardest hit areas in the country.
He says that most deaths happen when a user is mixing multiple substances.
There's very few deaths that are single drug deaths, and that's what people need to understand. You know, most people with addiction are using multiple things. And that's why it's not just, well, if we cut this off, we're going to be fine. It won't work, right? Because people use multiple things. And then it also says a lot to the adulteration of the drug supply.
Another part of the release shows thousands of calls coming through help hotlines throughout the year, something that Dr. Lloyd says needs to be timelier to ensure lives are saved.
We found that from the time somebody reaches out to get help to actually getting help, you got about 4 hours. Right. And it's why I've been on this soapbox ever since I came to West Virginia, is when somebody reaches out for help, you've got a very limited amount of time.
Dr. Lloyd moved from Tennessee and says he's been impressed with the system of care in the Mountain State.
The system of care that I've seen in West Virginia was not what I was expecting when I got here. It's so much better. Matter of fact, I go back to my home state of Tennessee a lot, and I tell them, I'm like, hey, you can like this or dislike this, but West Virginia is 5 to 7 years ahead of us.
Looking ahead to 2026, Dr. Lloyd says a big hole in the state is treatment of juveniles and is working to improve care for the next generation. In Charleston, Delaney Wells, 13 News.